Hello, guys. The topic now we are going to discuss now is called as abdominal paracentesis. So, before going to discuss about the abdominal paracentesis, we have to know what is meant by paracentesis. Is the paracentesis is a procedure during which fluid from the peritoneal cavity is removed to a needle. By using a needle, as you can see here, by using a needle, we remove the fluid that is which is present in the peritoneal cavity. So it is also called as abdominal tapping or ascites tapping. So next, abdominal paracentesis. The indication for it is there are therapeutic indication and diagnostic indications. First, we are going to discuss about the therapeutic indications. That is that involves removal of 5 liter or more of the liquid. So we take this liquid in order to reduce the intra-abdominal pressure or to relieve symptoms like respiratory distress and abdominal pain, etc. So when then coming to the diagnostic indication, we request only a small amount of liquid for the purpose of testing. Uh, the purpose is to find out the new onset of ascites or to determine etiology of any condition. And the next one is suspected spontaneous or secondary bacterial peritonitis, also in order to detect the cancerous cells and to differentiate transduate versus extubate. So next one is site where we have to insert the needle, that is 2 centimeters below the umbilicus in the midline or 2 to 4 centimeters superior or medial to the anterior superior iliac spines on either side. So next, coming to the position, so we use Flowers position that has shown in the figure. This should be used for the patient who is confined to the bed. And the next position, we this supine position, this position is we use for severe ascites. And the next one is the mild. In the case of mild ascites, we use lateral dubicatus position. It may be right or left. So next, coming to the contraindication for this process. So contraindications is uncorrected bleeding, intra-abdominal adhesions, distended bowel, distended urinary bladder, and abdominal wall cellulitis at the site of puncture, and in case of pregnancy. So these are the contraindications for the process. So we are coming next about complications for this process. So complications of this process is persistent leak from puncture site, abdominal wall hematoma, perforations of ball, introduction of injection, and hypotension after a large volume paracentesis. So after doing this process, we give we supplement the patient with 5 grams of albumin per each liter of over 5 liters of ascitic fluid that is removed to reduce the following. So we give 5 grams of albumin for each liter over 5 liters. So in order to balance the electrolytes, and in order to increase the serum creatinine levels that are secondary to large shifts of intravascular volume. So next, coming to the things that we need for the process to be done, the sterile gown, syringe with local anesthesia, that is 2% lidocaine for local anesthesia, sterile drapes, gloves, sterile containers, syringe for the needle for the aspiration, and non-collapsible tubing, sterile dressing set, betadine or chlorhexidine. So nowadays we are using chlorhexidine. So next is blood culture bottle. So these are the things that we needed necessary for the process to be done. So guys, this is the topic, abdominal paracentesis. So I hope you find it informative. Thank you.